Good morning, everybody. Let me see if I can, there we go. Okay. Hi, so I'm Diana Olson, the VP of Communications at the Infectious Diseases Society of America. It's a real honor to be here this morning. When I look at my colleagues on the panel, and then when I looked at the list of participants in the audience here, I have to admit to being a bit intimidated. I feel like I'm really the novice among experts here. The first speaker had a slide about all the different things that associations and societies do. I work for a society of about 50 people, and we do most of the things that were on that slide, so I'm very much of a generalist. But I think the reality is that if you're looking to partner with a society, there's a good chance that you'll be working with somebody who's a novice and a generalist like I am. So hopefully I'll have some helpful insights here. So this is a broad overview of IDSA. Our publisher is Oxford University Press. We have two very well-established journals that we've been publishing for many years, Clinical Infectious Diseases and the Journal of Infectious Diseases. They both have good, solid impact factors. They're highly ranked within the infectious disease field. They are both published twice a month in print and online. You can see their page budgets there. And the other interesting numbers that are on that slide are 1979 and 1904. So 1904 is the year that JID was founded, and 1979, which I think is the year I was in 7th grade, is the year that our society launched CID, which is the most recent journal launch before our new one that I'm about to talk about today. So there is definitely some irony in me talking about diversifying your publications portfolio, but what I want to talk about is how we got there. Last year, in 2014, working with OUP, we launched our first ever online-only, fully open access journal, Open Forum Infectious Diseases. And let's see. So in terms of what got us there, I think the first step was really back in 2010 when we transitioned to OUP as a publisher. And there were a number of reasons that we made that publishing change. We wanted to improve the sort of predictability of the revenue stream from our journals. We had been seeing fluctuations in previous years with reprint sales and supplement sales. We really liked the fact that OUP is a university-based nonprofit publisher whose mission and model really complements that of our society. We were attracted by the fact that OUP has a global reach and international base. Launching a new journal was really not on the list of things that we wanted to do at that point in time. But in the last few years of working with OUP, the thing that I have appreciated the most, I think, about our publisher is the fact that the folks at OUP are just very much of a data-driven, research-oriented institution. They have been able to point out data to us that helped us identify opportunities and trends that otherwise we probably would have overlooked. So in 2012, we did a strategic planning session and brought together some, not the whole publications committee, but some key members of the committee and our publisher. And there were different aspects to it. We started with a member survey. We surveyed about 8,500 of our members. We had a response rate of about 17%. And the demographics of the respondents pretty closely mirrored the demographics of the membership as a whole, so we felt good about those responses. We asked the respondents questions about both their perceptions of the journals from their perspective as authors as well as their perspective as readers. And the good news was, in terms of their perspective as readers, we found really high levels of satisfaction with our existing journals. But nevertheless, there were a significant number of folks who wrote in comments that revealed a bit of a pushback about having to receive these two journals twice a month in print. And there were a number of folks who, because of environmental concerns or other issues, were really beginning to push back. we were one of those societies that falls into the category, fortunately, of having some good revenue from print advertising. So this was an issue that we were kind of struggling with. Let's see. Okay. But to me, the part that was really the most eye-opening was the analysis that OUP did of tracking the manuscripts that had gone through peer review with our existing journals and then were ultimately being rejected. And so OUP did this, they presented reams of data, and they were able to really show us what ultimately happened to those manuscripts and where they were ultimately being published and what the impact factors of those journals where they were being published. What we were able to see was that we were really contributing in a very positive way to the scientific endeavor. But we were spending a lot of time and resources and money on manuscripts that were ultimately being published elsewhere. And so you can see there that the CID was rejecting 1,000 manuscripts a year. JID was rejecting 600. We estimated that at least a third of those were really high-quality manuscripts that potentially could be cascaded into another journal. And you can see there the number of manuscripts that were being published in the infectious disease category that year, and we found that we were capturing less than 9% of the total. So we concluded that there was definitely an opportunity there to launch a new journal. We liked the idea of launching an online-only open access journal to sort of diversify our portfolio and give us some experience with online-only publishing. So we took this information from the strategic planning session back to the publications committee. The committee was really intrigued by this concept, and the committee recommended to the board that we appoint a separate work group, this open access work group, to really flesh this concept out a bit more and work with the publisher to develop a detailed prospectus. And these were some of so I think this work group met over a period of several months and agreed, with the conclusions that we had found in the strategic planning, that there was definitely many good reasons to launch an open access journal. And as you can see from the slide here, big one is satisfying the need for our members to have more opportunities to publish with the society, diversifying the journal's revenue stream. We felt that there would be some support within the international community, and that was important to us because we have so many submissions from outside North America, and so many of the visitors to our existing journals' websites come from outside the U.S. But then I think probably the most important thing was this hope that it would eventually be able to position ourselves to give our readers, our members, greater flexibility in terms of their journal offerings with the society. So this is, you can see the editorial scope for OFID and the types of publications that we publish, and I'm pleased to tell you that we've had an incredibly successful first year. You can see that we've exceeded the manuscript submissions by nearly 20%. We've exceeded the number of published articles by about 25%. We anticipated that, because this is a new journal without an impact factor, that we would have to rely pretty heavily on invited submissions, and that many of the authors would request to have their fees waived. And the reality is that it's been significantly lower than what we projected, which has meant that we've received much more revenue than we initially had anticipated. And then finally, very recently, we got indexed in PMC, and I think that's going to help us tremendously. So we're off to a really good start, and I just want to acknowledge our publisher, Rachel Safer, who's here in the audience, and other colleagues who helped us get to this point. And certainly also to acknowledge our editor-in-chief, Dr. Paul Sachs. And that's it.